So for some of you, this might be your first experience with a webinar, and with others, I know you've joined us for a number of presentations, so thank you for that. Peaks to Prairie's EPA and the Wyoming Department of Education have worked together to design this series that was really to highlight what we know to be critical components of a healthy children's learning environment. The intent of this series was to provide school and school district administrators, custodial and maintenance staff, nurses, basically anyone involved with our schools with information and tools to move towards creating as healthy an environment as possible for our school children and for our school staff. So we began this series a few weeks ago, and we started out with school chemical cleanouts. From there, we moved into greening issues dealing with the building itself. Those were how to choose and work with green cleaning products, building materials, and some slightly scary realities of PCB and lead in some of our older facilities. From there, we've moved into a session regarding bullying and restorative practices, another equally important aspect of our children's health. And today, we're going to be discussing first aid. Next week, we have a talk on integrated pest management, and we wrap up with a discussion of waste reduction and recycling. And through this series, I'm really particularly excited to be working with folks to establish some linkages between environmental concerns, which are sometimes really not linked closely with children's health. And this has sometimes historically been a surprisingly large divide to cross. In Montana, and I think this might be a regional group, but a group called the Children's Environmental Health Network, whose mission was to really establish connections between agencies and initiatives working on environmental and health issues, anything concerned with kids. A network for people to come together and share stories and share resources, share information that's going out there, and try to bridge that gap that has sort of and historically been created between health issues and environmental concerns. So as I mentioned, I'm the coordinator of a program called Peaks to Prairies. We are a pollution prevention information center for EPA's Region 8, which is Montana, Wyoming, North Dakota, South Dakota, Utah, and Colorado. We're one of 8 funded regional centers whose mission is to distribute tools and information to businesses, technical assistance providers, schools, basically a huge variety of audiences for the purpose of aiding in the practice of pollution prevention. And pollution prevention is really just the elimination or the reduction of a waste at the source rather than controlling pollution at the end of the pipe, so to speak. We're a program under Montana State University's Department of Extension, Housing and Environmental Health here in Bozeman. Just a couple of housekeeping tips. We can't hear you. All the audience participants are by default muted, but we do want to answer your questions. So if you have questions during the presentation, you can type those into a question pane, which you should be able to see on your little dashboard there. If you can't see it, you might be able to find it by looking under the View button at the top of your dashboard, and you can click on the Questions tab there. So you can submit questions anytime, and I will compile those questions and ask those of Chris at the end of the presentation. You can also raise your hand at the end of the presentation, or whenever Chris decides she wants to solicit questions. You can raise your hand, and I can unmute your line, and that way we can hear you, and you can talk to us and have a regular conversation. And the other thing is that I'm going to start off with a couple of polls just to give Chris, our presenter, a bit of an idea about what our audience looks like here. So I'm going to start off with some of those polls right now before I introduce our guest speaker. So the first poll I wanted to ask was, what job function most closely resembles what you do? Are you a supervisor, teacher, nurse, facility manager, or something else? This is our way of trying to create some interactivity with some interaction with this webinar format. Looks like 93% of you have voted. Someone's still out there, but that's okay. Oh, 100%, nice. Okay, I'm going to close this, share the results. And it looks like 29% of you are school teachers, 14% are nurses, 70% are facility managers, and 50% do something else. That's great. The next question we're going to try and get a handle on is whether you're from Wyoming, another state in EPA's Region 8, or somewhere else in the country. Okay, 100% voted. And it looks like most of you are located in Wyoming. We've got some other folks within Region 8, and 29% of you are in other parts of the country. Well, thank you. Hopefully that will give Christina a little bit of information to start her presentation. And with that, I'm going to turn it over to Chris Bartholomew. She's a head nurse at the Laramie School County District in Wyoming, and she's going to tell us a whole variety of information about first aid. Christina, take it away.
Okay, let me get this set up here. Okay, there we go.
Great.
Good afternoon. As Mila said, I'm Chris Bartholomew. I'm the head nurse from Laramie County School District number 1 here in Cheyenne. I was invited to talk by Bruce Hayes from the Department of Education. I've been a head nurse here in Cheyenne for 8 years now, and a school nurse for 12 years. I'm trying to get organized here. Oh, not advancing. Show my.
Well, we see your screen, so you might just need to click on it once and then try those arrows again.
Okay. I tried the right. There it is. Came up this time. I have some background noise, I hope. The elementary kids are playing basketball outside my door, so it won't be obnoxious. What we're going to do today is look at some things that are affecting our school districts across the state and across the country. My background is I've also been on the executive committee of the National Association of School Nurses for 2 years. So I've had some exposure to what are important things that are happening not only in our district and in our area, but nationwide. And one of the things that I discovered during my tenure there is that Wyoming isn't as unique as we think we are in terms of the types of problems that are happening in our state. They're very much mirrored in other parts of the country. So what we're going to do is just talk about staff-specific role in the emergency medical system and do some basic outline of the Red Cross first aid plan, and then again bring it back into the specifics of the school setting, talking about the common injuries, common medical conditions. And if we have enough time, I want to talk on the 3 things that we're seeing and have really high consequences for us in the schools in our state: the conditions of diabetes, asthma, and seizures. And my overall objective is to give you a brief introduction. I don't know if you guys have the opportunity to take full first aid courses in CPR, but considering the nature of Wyoming, I would highly encourage that, and I hope this whets your appetite to get some more information in your local area. It's not advancing again. Okay. So the school-specific issues. Why is planning for first aid important? We do have some very unique aspects of Wyoming that we need to think about. First off, because we're a rural state, what does that mean in terms of providing first aid in our school situations? We have things like weather that'll shut down half the state at a time. Distances, the extreme distances that people have to drive to get services. Low population. The thing that we were looking at as school nurses is distances to medical providers. You know, do you have a hospital? Do you have medical offices? Are they part-time clinics? Are they full-time clinics? And a really important thing that we need to consider, too, is our response time for emergency medical services. Why is it important to plan in the school setting? Our school populations change. Think about what's going on in Wyoming right now. We have high turnover of families in certain areas. Just think about the things like the mines and the oil fields. We have areas that have high migrant worker populations. And then we need to look at short-term versus long-term needs of schools, of school children, versus a child who has surgery and has a cast versus someone who has long-term chronic medical conditions. All those things affect how we plan in the schools. We have to keep medical information up to date. Yearly, we should be doing updates just to see if anything has changed in medical conditions of children. And then the legal implications of keeping students safe at school. It used to be that we thought only about the IDEA and the Rehab and the Disabilities Acts only having to do with education. But now we've come to understand that these legal responsibilities also fall with children who have medical conditions. It's not just the category of other health impaired anymore under special ed. It's really the kids who are regular ed who do have chronic medical conditions. Those type of children also fall under these acts. And an important thing is this first point: any school that receives federal funding or any facility considered open to the public must reasonably accommodate the special needs of children with disabilities. And it's supposed to be provided within the child's usual school setting with as little disruptions to the schools and the child's routine as possible, and allow the child full participation in all activities. Those are the things that we need to be concerned about when we're dealing with children with special needs. Federal law requires an individualized assessment of any child with disabilities. Children with chronic medical illnesses, that's usually done by the school nurse. The school nurse will pull in the other people if she has indications that it becomes an educational need, it becomes an accommodation in the classroom, those type of things. The people who are involved with the American Diabetes Association are really active, and they have put together some consortiums of parents where they have gotten to the point where some states have disease-specific legislation controlling how and who and when children with diabetes are taken care of in the school. My opinion is that's not always the best system, because you can wind up having specific people doing specific care for specific diseases. But I just want you to know that these kids are really covered under the same disabilities education laws and acts, IDEA, and the whole 9 yards that our special ed kids are. I forgot to mention that I'll take questions anytime. You don't have to wait until the end, too. So what do you do when you start thinking about first aid needs in your buildings? Every building is the same. I mean, it's different. No one is the same. You have to first off evaluate the resources in the building. Do you have a school nurse? There are locations in the state that a school nurse might be there a half day, 1 day a week. So you really need to look at how often the school nurse is there. It's my understanding that each school district in the state of Wyoming does have a school nurse. But there's a big variety in terms of their availability. I know one school nurse in our state covers 9 schools, and there's 140 miles difference from one end of the district to the other. So those are the things that you need to evaluate. How much can you depend on the school nurse to be a backup in terms of first aid? Who's trained in CPR and first aid in your building? There are some schools, for instance, that do use parents. I know of a situation where a parent of a student with diabetes was also a teacher at the school. So that parent was able to contribute and meet the needs of that child. And then how many staff members are trained or potentially could be resources to the children. The other thing that I want to throw out too is that not only the resources in the building, but you also have to look at the staff population. The school nurses in the state are finding more and more that they are spending time with the staff in the building. So that's another piece of the pie that you have to look at in terms of coverage. You need to evaluate the resources in the community. Who are the first responders? Emergency medical services, are they volunteer versus paid ambulance? Are they a volunteer fire group, or are they paid to be a firemen? That can make a difference. If you have a rancher who's a volunteer fireman or an EMS person, and he's out on his ranch someplace, what's the response time to an illness anywhere in the community? So those are the things that you need to look at to start out what are the emergency services available. Then you need to look at your health care providers. Do you have a clinic in your area 5 days a week, but it's only 9 to 5? Who's the after-hours person that you call? Kids are at a basketball game, and it's after hours, the clinic is closed. What's your setup for getting some assistance when you need it? The hospitals versus clinics, it's the same thing. How far are they? All these scenarios in schools, I'm sure all of you have seen it or have been affected by it. Most common injuries, just the normal broken bones, abrasions, but look at the concussions that we see with sports injuries, the playground injuries, accidents, choking, poisoning. We do have, there's more literature now about sudden death in teenagers playing sports. That's relatively new to the scene. Common medical conditions in schools. Diabetes. In our district here in Cheyenne, we have over 50 insulin-dependent diabetics. A couple years ago, it was down in the 30s. We've had a great expansion. And I'm sure most of you are aware of the obesity epidemic and how that is contributing to diabetes. ADHD, asthma, seizures. We have lots of kids who have life-threatening allergies to things like peanuts or certain food products. And unfortunately, we are seeing kids with psychiatric emergencies, suicides. We just had an incident in our school district where we had to send a child to the emergency room for an overdose. That can be a psychiatric emergency. Cardiac emergencies. 20 years ago, we weren't seeing kids with severe heart diseases being fixed and coming back to school. In that period of time, those kids normally would not have survived. Many of them would not have made it to even kindergarten. But now we are seeing kids with, I've personally taken care of kids with transplants. That changes the whole realm of what we need to think about in the schools. Real common one is the migraines, the neurologic diseases, and of course our disabilities like cerebral palsy and genetic conditions that we see in the severely disabled populations. School staff play a major role in making the emergency medical system work effectively. We are a big part. We're usually the initiator. We're usually the organizer if someone needs care. The EMS system is a network of police, fire, and medical personnel as well as other community resources. There's 4 basic steps in that you need to think about when you are starting or being involved in the EMS system. And this portion of it is right from the Red Cross First Aid book. But I wanted to take you through them because I think they're important. Step 1, recognize that an emergency exists. It sounds really logical, but we need to be aware and alert at all times. And how do we do that? Your senses really tell you. Hearing, sight, and smell help you recognize an emergency. And they're often signaled by something unusual that catches your attention. Unusual sights. These are just general ones. A stopped vehicle on the roadside. You know, these winter storms that we get here in Wyoming. Broken glass, overturned pot in the kitchen, spilled medicine container, downed electrical wire, sparks, smoke, or fire. Now, how would you translate that into schools? A child or a staff member is in an area that they're not usually have access to. There's other signs. You might see physical evidence of an emergency, those type of things. Unusual appearance or behaviors, obviously unconsciousness. If the person is confused or has unusual behaviors, trouble breathing, clutching the chest or the throat, slurred, confused, or hesitant speech, unexplainable confusion or drowsiness, sweating for no apparent reason, uncharacteristic skin color, and inability to move a body part. And there's implications here for children and for adults. Like I said, we do get more interactions with staff members now. Unusual odors. Odors that are stronger than usual or unrecognizable or inappropriate. You know, why would you be smelling gasoline or some other toxin in the middle of a school building? Unusual noises. And this, you know, this is just pretty common sense, but it's worthwhile reviewing it. Screaming, yelling, moaning, or calling for help. Breaking glass, crashing metal, or screeching tires if you're outside. Sudden, loud, or unidentifiable sounds. And the opposite could be unusual silence. And I guess to summarize those points is that you have to use your judgment. You trust yourself. You know what's normal in your building or in your school or in the area that you work. And, you know, the old saying, if it looks like a duck, quacks like a duck, walks like a duck, it probably is a duck. So, you know, trust your judgment. No one's going to ding you if you call attention to something and it winds up being okay. I'd rather always encourage people to err on the side of caution than to totally ignore something. The second step in the basic EMS activation is decide to act. Unfortunately, you must decide whether to help and what to do. It brings out mixed feelings in people. It's normal for people to back away or ignore it or want to ignore it if they're really unsure of themselves. But what happens if you don't act? What happens if someone suffers an irreversible damage or problem if someone does not step up to the plate and act? There are things that keep people from acting. And I think if you recognize these and you understand the feelings that you're going through, it'll be easier for you to step up to the plate and make sure things are okay. One of the things is the presence of other people, being unsure of the ill or injured person's condition, the type of injury or illness, fear of doing something wrong, fear of being sued, or being unsure of when to call 911. The first one, the presence of other people. Do not assume someone is already assisting. Unfortunately, in our society, you've heard of these horror stories. Not too long ago, that there was, and I don't even remember where it was, that gal who was raped after a basketball game, a student, and there was hordes of people around, and nobody reported it. Chances are what happened was someone was assuming that someone else was taking care of it. So always, always, always ask if you can help. And overcome that embarrassment to say that you can, that leads you to not say that you help. You need to say that you can help. You may be the only person in the crowd who knows what to do. And even if other people are helping, there's still things you can do. You can direct people to call 911. You can direct a student to go get the nurse, to get the principal. You can be directing someone to take the other students from the area, or to cover a class, or get the first aid supplies. Don't limit it to actually, I mean not actually, but that it has to be you that provides the actual care to the victim. There's lots of other things in emergency that people can do. But always, always, always ask if you can help. The next one is being unsure of the ill or injured person's condition. We have had situations where the victim denies injury, or the person who is affected acts strangely or is uncooperative. I don't know, some of you might have seen students who are high on drugs or taking alcohol or overindulged in alcohol. They can be very uncooperative. Does that mean that they don't need help? No, it means that you need to be sometimes even more assertive to prevent that kid from getting in the car or from going home by himself where he could pass out and have alcohol poisoning. We had an instance here last year where a student collapsed in a nurse's office and had alcohol poisoning. So there are times when, yes, the person is giving you different clues not to get involved, but you absolutely have to act for their own safety. Stress can bring on defensiveness, and the person can get angry. But if the bottom line, if in your gut you feel like you are threatened, back away, just observe the situation and call 911, or in your local area you might call the police first, especially if you have someone who is combative and you feel like they're a threat to your own personal safety. The next one, the type of injury or illness. Injury or illness may be unpleasant. I've seen people pass out from the sight of blood. The older I get, the smell of vomit makes me want to vomit. But that doesn't mean that I'm not going to act. I might be thrown up next to the person. But blood and vomit, bad odors, you have people who have deformed body parts from injuries. And then the basic thing, cleanliness, which I wouldn't want to do CPR on a homeless person, but we still need to be there for care. Deformed body parts, you know, if someone has had an amputation, the worst thing you can do, for instance, is to walk away and not stop the bleeding, those type of things. So adrenaline kind of kicks in, but just be aware that what you're experiencing is very normal. Fear of catching a disease. This is real. It's a true concern, but now we have the knowledge and the tools to protect ourselves. I can't stress enough the concept of universal precautions. It's a concept of blood-borne disease control which requires that all human blood and certain body fluids be treated as if known to be infectious for HIV, HBV, hepatitis B virus, and other blood-borne pathogens. We know how to protect ourselves through universal precautions, and this works. Otherwise, there wouldn't be any nurses, doctors, EMS, or other healthcare providers to take care of patients. The reason we have gone to universal precautions, and I'm not sure if your people in your local location cover this in your annual OSHA bloodborne pathogen training, but part of the reason our whole country has gone to the concept of universal precautions is because of the privacy concerns, and I'll get to that in a second. The personal protective equipment are available to us now that we can protect ourselves. It's defined as gloves, masks, eye protection, aprons, or any other safety equipment. and it does not permit the blood or other potentially infectious materials to pass through or to reach the employee's work clothes, street clothes, etc. Prevents them from going into the mucous membranes under normal working conditions. These are supposed to be supplied to you by your employer. And you need to notify your supervisor if PPEs are needed. We've had a rash of kids in this district over the years, not a rash, I guess here and there we've had spitters and biters, those type of kids. They're not real easy to work with, but we have to figure out mechanisms for protecting ourselves. Wearing smocks, we've gotten, excuse me, we've gotten face shields for classrooms with spitters in the PALS classroom. One of the other things that you can do is keep a pair of gloves in your desk. I'm sure whatever your system is there, our nurses routinely pass them out at the beginning of the year so that people can carry, have them in their desk or put them in a fanny pack when the kids go out for recess so that you always have something available. Same thing with field trips, protecting yourself during field trips. Other personal protective equipment concepts. Disposable gloves must never, ever, ever be reused. Hypoallergenic, allergic gloves are available. Those are the non-latex ones. The prices have come down on those recently, so they're not as cost prohibitive as they used to be. But the school district is still required to supply those for you. Utility gloves are those big rubber things that construction workers, plumbers, and that kind of stuff. Those can be cleaned, but we wouldn't be using those. Laundry facilities, I don't know what your systems are in your individual districts. We send our laundry out now, but if the laundry is contaminated with blood or other infectious material, we need to label it for the safety of our custodians and people that are transporting the laundry, or the people that are doing the washing. Why are we concerned about it? The federal laws are such that employees or students are not required to reveal medical conditions, including infection with bloodborne pathogens. This is a real law. So that is the big reason that you need to be abiding with universal precautions. We are a state that is not isolated from the bloodborne pathogens. There are people with HIV and AIDS living in Wyoming, but unfortunately people get a little complacent about dealing with situations because they know the family or they know so-and-so's whatever history in the community or the school. That doesn't mean that they haven't been exposed to some sort of bloodborne pathogen. Just as a review, confidentiality, the quality of being confident, private, or secret. What does it mean? This is really where the rubber hits the road. Inappropriate sharing of health information without written permission that reveals information about the child, which is the private domain of the family. And any breach of the confidentiality, the sharing of information without written permission, can result in serious consequences. This can lead to lawsuits for the school or the facility, and there are some places that will say you could lose your job if that confidentiality is broken. I want to give you a couple helpful hints for safety. Many of you, if you're in a small community, I know you wear many hats. You're the baseball coach, you're the 4-H leader, you're the church group leader, those type of things. How do you protect yourself in those forums? Universal precautions should be used in those forums too. And a 1 to 10 solution of bleach and water is a standard recommendation in the absence of commercial supplies. You can use them on field trips, sports events. But one thing you want to remember, what happens to bleach when you leave the top off it? It dissipates into the air, so you need to change it every day. If a victim is alert and able to follow directions, have the victim apply pressure to the wound until you can get your gloves on and you protect yourself from bloodborne pathogen exposure. Always, always, always be consistent about washing your hands. Remember, even if you get a bloodborne pathogen on your body or have an exposure of some sort, the likelihood of you getting an infection is pretty low. Remember that all of our kids now in Wyoming have to have an immunization for hepatitis B. So things are not like they were, well, I think it was in 98 or 99 that hepatitis B was starting to be required. So that's one that we really don't have to worry about too much with the school children. Excuse me. Another thing that keeps people from acting is the fear of doing something wrong. And I'm going to combine it with the next one. The fear of being sued is real. People worry about that. I don't know enough. I don't think I can do anything, so I'm just going to back off. But I want to review that there are Good Samaritan laws in all 50 states. And those give legal protection to people who willingly provide emergency care to ill or injured persons without accepting anything in return. So there is some protection. What we have to look at, though, is that Good Samaritan laws were developed to encourage people to help others in emergency situations. And this is really the gist of if when somebody sues somebody, if it's going to go through or not. The Good Samaritan laws require that the Good Samaritan use common sense and a reasonable level of skill, and to provide only the type of emergency first aid for which he or she is trained. They assume each other person would do his or her best to save a life or prevent further injury. So that's where the Good Samaritan laws are protect you. Now, if you took something on because you saw it on TV on Grey's Anatomy, well, that's not common sense. That's not what you were trained for as an individual unless you're a doctor. So that's where the common sense thing comes in. So I know in Wyoming we're a pretty helpful bunch of people, and we would be judged against that standard. The other thing is being unsure of when to call 911. And that's a concern. Oh, I hate to waste the taxpayer's dollar. I don't know if it's really necessary. And if you're in a rural community, do I really need to call Mr. So-and-so or Mrs. So-and-so from the field or their work environment to come and answer an EMS call? So that makes people kind of nervous too. But there's a couple things you need to understand. First off, when you're faced with this list of things, these are absolutes that you need to call 911. No matter what your feelings about inconveniencing someone. The absence of airway, breathing, or circulation, the ABCs of CPR. Loss of consciousness. Anybody who was unconscious for a period of time really needs to be checked out. Severe trauma, severe bleeding or blood loss, chest discomfort, pain or pressure that persists for more than 3 to 5 minutes or that goes away and comes back, severe burn, vomiting or passing blood, pressure of pain or pain in the abdomen that doesn't go away. Boy, I checked this thing like 4 times and I still missed that typo, I'm sorry. Has a seizure that lasts more than 5 minutes or has multiple seizures. Has a seizure and is pregnant. Has a seizure and is diabetic. There's special implications for those two. Fails to regain consciousness after a seizure. Has a sudden severe headache, slurred speech, or loss of movement on one side of the body. That could signify someone having a stroke. And early intervention leads to good recoveries and good results after someone has a stroke. Appears to have been poisoned. You see a toddler laying on the floor or a young child and there's spilled pill bottles, those type of things. Absolutely has to be seen by someone. has injuries to the head, neck, or back, and we're going to go into that a little bit later, has possible broken bones. And there's some qualifiers, which I'm also going to discuss in a little bit. Just want to review giving permission to give care. Before giving first aid to an adult, you must have the person's permission or consent. To get permission, you must tell the person who you are, how much training you have, what you think is wrong, and what you plan to do. Okay? For myself, Chris, RN, I would tell the person, I'm a registered nurse. I think you need to be seen by someone. I have CPR training, those type of things. I don't think you should get up. I think we need to wait and have the ambulance transport you. That's the type of stuff that you need to tell the person. Do not give care to a conscious person, conscious adult who refuses it. I'm not saying you should just walk the other way. Obviously, if you feel like someone is in imminent danger, what you could do is just step back, observe, and still call 911. But just be aware that they do have a right to refuse care, but within reason. If they look like they're going to jump in front of a train and you back off, you're not going to leave that person alone. Permission is always implied when you come upon a person who's unconscious. Some special notes about people under the age of 18. If a conscious person is an infant or child, permission to give care should be obtained from a parent or guardian when one is available. If the condition is life-threatening, permission is implied if a parent or guardian is not present. You're not going to wait until someone comes that is a parent or guardian if it looks like the child is in serious trouble. If the parent or guardian is present but does not give consent, do not give care. Instead, call 911 or the local emergency number. Again, it's a situation where, yes, the child is under them legally, but if you have concerns about someone making a poor decision about not getting care, I always err on the side of caution. We've had a couple instances here where a child was unconscious and the parent refused to let the child be transported. When the parent comes on site, legally they do take control of the situation and their legal responsibility. But I would be very sure to let them know that you disagreed and you really thought that they needed to be seen.
Christina, I have a couple of questions regarding the point you're making.
Okay.
And one is, if a student has a broken arm, maybe whether it's serious or not, let us know your opinion on both. Do you think you should immediately call 911, or do you need to get a hold of the parent first?
I think there's a couple things you need to consider. One is the response time of the ambulance. But first I would look at the seriousness of the injury. Is the child talking? Is the child able to be calm and you can control the pain with ice? I personally have done ice packs and called the parent if it looked like the parent could transport the child without a lot of danger to the child. It's kind of, you've got to evaluate the situation. Now, if you got a bone that's sticking through the skin and there's no way in heck that you can stabilize or immobilize that joint, I would simultaneously call the ambulance and call the parents. And usually what I would do is just call the parent and say, what's your choice? Do you want to come here or do you want to meet the child at the emergency room? It's kind of like you do, to a certain extent, have to evaluate what's going on immediately. I hope that answers your question.
No, that's great. I'm sure it did. And it's kind of a related question. So in a situation like that, or in another, maybe an asthma emergency situation, can nurses provide Benadryl, ibuprofen, albuterol, those types of drugs?
I think it depends on your board policy and also whether you have a medical advisor for your district. There are some school districts that have a medical advisor, although nationally there's a lot of school districts that have gone away with standards that you could provide those type of things. I think that's kind of a tricky situation. Benadryl without parent permission, I would, if I thought the child was in serious enough situation, I would call 911 for an asthma episode, especially if the child did not have an inhaler available. But many school districts do not have standing orders with physician backup, so it would make it really difficult because that's making that decision. The school nurse is making that professional decision that the child needs that, which may or may not be backed up by the family.
Great, thanks, Christina. Go ahead.
Okay. School nursing always, you know, it's sometimes you got to slide by the seat of your pants. Okay, activating the EMS system. I wanted to just review this with you because some of you have never called 911, and until you do it, you kind of get like, whoa, they're asking me a lot of questions. When you call 911, they will ask your phone number and address and other questions to determine if you need fire, police, or medical assistance. Now, in the smaller communities, it might be all the same person, so it really doesn't matter. But the person who calls 911 really needs to focus on remaining calm so you can give clear answers. You need somebody who has a steady hand and can take information and process it. Because important decisions are being made on the other end, like how urgent is the call. I've done things like you need to come to transport this child, but you don't need to do lights and siren. That's just something that we know we can't move the child, but they're stable, versus lights and siren, this kid needs to get to the hospital right away. The call taker may stay on the line and continue to talk with you. And a lot of them are trained to give first aid instructions so that they can assist you with any of the life-saving things until EMS arrives. One of the things that happened to me my first week of being a school nurse was I got called to Mrs. So-and-so's room, but I didn't know where the room was. So make sure that you always have someone meet the EMS at the building entrance and take them to the site of the emergency, because you can lose really valuable time if the person is wandering around. You can clear the furniture away. You can make the access to where the victim is much easier if you prepare a little bit in the time when the call is made until they arrive. Giving care until the help arrives. This can be a wide variety of the care that you might give. It can be everything from basic first aid to CPR and advanced life support. Obviously, we're not doing a CPR course, but I would highly encourage everyone to take a CPR course. And hopefully you'll never ever use it, but you never know when you're going to be in a circumstance. I've been a nurse for over 30 years, and I've never had to do mouth-to-mouth. I've had to do chest compressions, and I've had to organize an emergency situation. So hopefully having the training will make you feel more comfortable. There are courses that are online now, the American Red Cross and the American Heart Association. I'm most familiar with the American Heart because that's what I'm certified in, but they have lots of options now for doing the coursework online, and then you only meet with the trainer physically one time to perform your skills to make sure that you are doing them correctly. So there's lots of options, and again, I highly encourage everyone to do that. First aid care until the EMS arrives. These are some basic considerations. They're guiding principles, really, from the Red Cross. Do no further harm. is one of the guiding principles. Monitor the person's breathing and consciousness. Help the person rest in the most comfortable position. There is an exception to that, though, if you're really seriously considering that thinking that the person has a neck injury. There is that exception. You do not let that person move. You keep them in the same position until EMS can get there and stabilize the head and the neck. Keep the person from getting chilled or overheated, especially if a person has experienced a loss of blood, or if they're outside. That can set them up for getting into shock and lots of other complications from that. Reassure the person, handhold, say we called for help, we called for your parents, we called, help will be here soon. And then give any specific care needed that you can provide. Just want to, this is available on the handout, but these are the Red Cross recommendations for a first aid kit. That's pretty standard. I just wanted to offer that to you. Just point out now that they are asking people to carry 2 packets of 81 milligram of aspirin in case you suspect that someone has had a heart attack. Some of the other things that I carry with me if I respond to an emergency: saline eye wash, if you don't have a way to wash out an eye injury or something that's gotten splashed into a person's eyes, a flashlight, blood pressure cuff, and stethoscope. Biohazard bags, skin cleanser, hand sanitizer, eye protection, splints of various sizes. And I added this in here because we are preparing for, in our emergency situation, for school evacuation. So don't forget, when you have a school evacuation, you need to have a ready box or a go kit. A lot of people call them that. But you also have to add things to it. Emergency supplies for students with diabetes, like testing materials, snack, glucometers. Someone needs to be assigned to bring the student medications and care plans, especially things like inhalers, EpiPens, Diastat, rectal Diastat if someone has ordered it in your school. You want to be carrying those with you if there is a school evacuation and the children are not allowed to get back into school, neither were you, even if you need emergency medication. So make sure that you're grabbing those type of things when you do get out of the school. Just some reminders about where you should have first aid kits. I've seen all sorts of injuries in my years. The gym, the kitchen, shop class, auto mechanics. I've seen kids put a sewing machine needle through their fingernail. Science lab, burns, school buses and bus garages, field trips and sports trips. Obviously the nurse's office, and then we talked about the to-go box. Custodial offices. Some of these people work after the nurses go home. And maintenance offices. Just some brief common sense things about the type of wounds. The first is the closed wound. The closed wounds are those things that we need to, oh, I'm sorry, I forgot to mention one thing about the first aid kits. I'm looking at my notes in front of me. Make sure someone is assigned to restock those after they're used. The worst thing you can do is have somebody use the first aid kit and then the next person that uses is missing supplies. So make sure after it's used that it is restocked. You really might have to assign someone to do that. Okay, go back to closed wounds. For example, bruises. Ice can be put on bruises with a barrier, and the routine recommendation is 20 minutes on, 20 minutes off, and then repeat. And you want to try elevating that extremity if at all possible. One of the big things that you need to think about, though, is do not assume that all closed wounds are minor injuries. Call 911 if a person complains of severe pain or cannot move a body part without pain. And you got to use your common sense here when you think that the force that caused the injury was great enough to cause serious damage. For instance, a child rides a bicycle into a car. well, you got a car going 30 miles an hour and the kid wants to jump up and say he's fine, well, I'd be really highly suspicious of that, because number one, you've got adrenaline flowing in the kid, and they may not even know that they're in pain yet. So if the force that caused the injury was great enough to cause serious damage, think about, you still need to call 911 and have them checked. An injured extremity is blue or extremely pale is another reason to call. Oops, my advance quit. Open wounds. These are the most common things that we see in the schools: abrasions, cuts, and lacerations. Punctures are dangerous because you don't know if it's a clean puncture wound. You don't know if it's gone in deeply. Basically, the treatments are looking at the cleanliness of the wound and dressing it so that we're avoiding infection. Stitches, that's kind of a judgment call. If you have questions, it looks deep, especially if it's a puncture or a laceration. It doesn't hurt to get an opinion from a doctor or your local clinic or your EMS to see if stitches are needed, especially if your nurse is not available to say, oh yeah, that really needs stitches. And then again, protect yourself during the care. Things like fights in schools can be a combination of open and closed wounds, and you start dealing with the one that's bleeding, and then you start assessing and seeing what else was hurt. Girl fights are nasty, especially at junior high. I was a junior high nurse. Just want to review some basic stuff about wounds because I see misinformation out there in lay people about wounds. In burns. Burns are classified by sources: heat, chemicals, electricity, and radiation. The deeper the burn, the more severe it is. We don't really need to know if it's first, second, or third degree. Nobody's expecting lay people to know that. But you need to understand that the superficial is first degree, partial thickness, second degree, and full thickness is third degree. If you see the total top of the skin is gone, then that needs to be seen by the doctor. If it's just a reddened skin, those type of things, probably not. But the deepness of the burn is really the issue there. Call 911 if the person has trouble breathing. That could be a sign that they inhaled the heat source, especially flames. Burning of the upper airway can lead to those airways can close down very quickly if you think somebody has inhaled flames or had flames in the face. Has burns covering more than one body part or a large surface area? Has suspected burns to the airway? Talked about that. Has burns to the head, neck, hands, feet, or genitals? Has a full thickness burn and is under the age of 5 or older than the age of 60. And part of the reason they pull those age groups out is because of fluid and electrical balance. The body surface area in a 5-year-old child is proportionately high, so they are very prone to getting into severe electrolyte imbalances. And the older than the 60 person basically cannot self-regulate if they lose and have damage to fluid and electrolyte balances.
Chris,
911 really needs to be called if the burn is resulting from chemicals, explosions, or electricity. And I'm going to mention those a little bit.
Chris, can I interrupt you for a minute and ask another question?
Sure.
I know many of us, especially Wyoming, Montana, live in really rural environments, and is it ever appropriate for these in the case of a pretty serious injury for a teacher or a staff member or the school nurse to take a student directly to the hospital rather than waiting for perhaps a volunteer fire department or an ambulance or waiting for a parent to arrive?
I think there's a couple things that you really need to look at. number one, what are your school board policies about transporting students? Because if you're not covered in the school board policy, you're really taking that personal liability on yourself. Now, if you had the parent go with you and you had full cooperation from the parent and their permission to transport a child, I think that would be less of an issue. For instance, in our district, we're supposed to take a special course for us to be able to transport kids.
Okay.
I think that's another thing that sometimes you have to slide by the seat of your pants with the principal's permission, the parent's permission, and if the nurse's judgment that the child is really suffering and going to be worse off waiting, then I think, again, you err on the side of getting the best care you can as quickly as possible. Teachers, I would be very cautious for non-nurses to have the background to know whether you can move a child or not, or another staff member. It's a little bit easier with staff members because they can give you the permission. But say, for instance, somebody had a concussion at a football game. Time is of the essence to get treatment, but I would do that with the support of the parents there and the backup of the principal if you felt like you need to move it. That's not a really clear answer, but again, you're looking at the situation, who responds to your emergencies and how quickly can they get there, and how are you backed up legally by your school board policy is an issue. Okay, I just want to go over under open wounds, the burns. Treatment for heat burns, obviously you're going to remove the person from the source of the burn. Hopefully, you know, the person is not unconscious and they'll automatically pull it away from the burn object, the heated object. Check for life-threatening conditions. Again, is the child, the person talking, walking, responsive, aware of what's going on, those type of things. Cool the burn with large amounts of cold running water. Now, this is right out of the Red Cross book, but I feel I really need to qualify that. If it's a really deep burn that goes through several layers of skin to where you're looking at red tissue underneath, cold running water is not always the choice. Superficial burns where the skin is red and maybe a minor blister type of thing. But once you get past blistering and layers of skin gone, you want to keep that wound from getting friction in it. The cold running water could possibly cause damage. So if it's a severe burn where the skin is really peeling off and it's very deep, I advise against cold running water. I would just keep it open and not knocking into anything. Don't put a dressing on it. Keep them in a clean area. If you're in a dirty area, you might have to put a protection over it if the child has to be transported someplace. So that's kind of a question where you have to use a judgment call again. It does say in the Red Cross to cover the burn loosely with a sterile dressing. If you don't have a sterile dressing, I would leave it open until you get to a place where you do have a sterile dressing, or unless, again, if there's debris in the air, if you're in a fire or something like that. Minimize the shock by keeping the person from getting chilled or overheated. One of the most common mistakes I see people make is to apply ice to a burn. Ice is really not good for a burn because it can damage the skin layers under the burn, and it can actually cause more damage to the area. Do not break blisters. There's a reason those blisters are there. Those blisters keep the area that's burned moisturized, and it's sterile. You break those blisters open, you're creating a route for infection to get into the burn area. Do not apply any ointment. This old-fashioned whatever put on it, Vaseline or whatever, is not good for burns. You want to leave them open, dry, protected. Well, not always open, but you definitely want to cover it if a blister has opened up because you want to prevent the infection going in there. Do not try to remove pieces of burned clothing, excuse me, because you can cause more damage, or don't try to clean the burn. That's really up for the experts, and it's an extremely painful process for burn victims. Chemical burns, the whole goal is to remove the chemical from the body as soon as possible by flushing body parts or eyes for at least 20 minutes. 20 minutes is a long time, and you have to actively look at 20 minutes on a clock because it just seems like an eternity. You have a chemical spill or a splash from a science lab. It's really hard to keep teenagers washing their eyes for 20 minutes, but it does work. And then you have to go through the process of figuring out what the burn was it poisonous? Sometimes I've had to call poison control based on a chemical from a lab. So those are the things that you need to find out and get information to the parents or for the doctor to evaluate, or the ambulance crews. Electrical burns are kind of tricky because you could put yourself into danger if the power is not turned off. Don't ever put yourself in danger until the power is shut off, because you could wind up lying on the ground next to the person because there's no way to really check if the power is still flowing through that person. It sounds kind of cruel, but the reality is you don't want to be a victim too. Bloody noses, first aid. We see a lot of those. The causes: blow to the nose from a blunt object, high blood pressure, and a change in altitude. Excuse me. To control a nosebleed, these are some of the old-fashioned things. You always saw people's old remedies, but right now the recommendation to control a nosebleed is to have the person lean forward and pinch the nostrils together until the bleeding stops. And a good rule of thumb is don't have the child, this is difficult with a child, don't let them peek at the nosebleed for a full 5 solid minutes. They have a tendency to want to dab and look and dab and look, and then you're not putting enough pressure on there for a clot to form. And I always instruct kids to hold the nose where the soft cartilage meets the bony process of the nose. Well, it's bony cartilage, actually. Well, it's cartilage. Soft tissue. I'm saying it wrong. Soft tissue and the cartilage meet. So press together for 5 minutes and let the child do it. Sometimes you as an adult have to take it over because the child just cannot resist looking and the bleeding doesn't stop. The old-fashioned method was people would instruct kids to hold their head up, and what happens there is the blood gets swallowed, and then you wind up having a child or a staff member vomiting afterwards. So lean forward, let any secretions, blood, whatever, come out the nose so it doesn't get swallowed. Some other things that the Red Cross book cited that I've never really tried include ice to the bridge of the nose or putting pressure on the upper lip just beneath the nose. So that's a Red Cross recommendation. I think the best way is to have the person lean forward and press the nostrils. And always, always, always protect yourself. Have the child pinch until you can get gloves on. I had an episode here a few years back that a staff member was really afraid to help this child with a bloody nose and wound up with a puddle of blood on the floor to the point where I was really worried about blood loss. So have the child hold the bloody nose until you can get your gloves on. I've seen recommendations in emergency training where use a trash can liner on your hand if you don't have a glove handy. Use a Ziploc bag, whatever you have handy. It's an adequate protective barrier until you can get your gloves on. This is a tricky one. Signals of serious muscle, bone, or joint injuries. Again, the first thing that you want to do is try to figure out what happened to the child. Lots of times these aren't witnessed. You look for things like deformity. Boy, that arm just doesn't look right. Obviously something needs to be checked out. Bruising and swelling, inability to use the affected part normally. Bone fragments, that's a no-brainer, sticking out of a wound. Person feels bones grating when they make a movement, so tell them to stop moving and try to immobilize it. The person felt or heard a snap or pop at the time of injury. The injured area is cold and numb, or the cause of the injury suggests that the injury may be severe. Got run over by a car. Well, yeah, your arm's probably broken. Even though the person is saying, oh, I'm fine. You can have denial. That doesn't mean a thing. The kid's hurt. Basic concepts to evaluate for broken bones. The location of the injury. Are you able to immobilize or splint? Splinting is kind of tricky. Let the nurse, EMS, or someone who is trained splint the person. Basically, you keep the arm or the joint in the position that you found the child, which means taping it to a board, taping it to a splint, padding it and elevating it, usually with an ice bag. An ice bag can control the swelling and pain until they can get care. And then again, you're going to evaluate how far is medical care. And again, the issue of do you transport or not. I've let parents take kids to their doctor's office or emergency room if I'm able to stabilize it enough. I always keep ace bandages in my office so that if I have to immobilize something, I can use the ace bandages to a board or a splint for transport. But again, you're going to evaluate, is that child with it? Is he acting like he might have had a head injury with it or something else is going on? That type of child, for instance, I would not put in my car without other supervision by the parent or the principal. In this day and age, there's a lot of parents that don't have transportation, and I know you do want to assist them if you can. Neck injuries are tricky. Although head, neck, and back injuries make up only a small fraction of all injuries, these injuries may cause unintentional death or lifelong neurologic damage. They can cause paralysis, speech or memory problems, or other disabling conditions. Neck injuries are really tricky to deal with, and that's where you really need a more complete first aid course or some other information before you decide to take on working with someone with a neck injury. A basic guideline, though, oops. Where did I put it? Nope. Probably got it in my notes. One of the basic guidelines is to gently support the head until EMS arrives. Thought I had a slide on it. That involves sometimes people learning how to support the head on each side with your hand. And I've done this. It's tiring. But you don't know what type of injury is in that neck and whether there's something that could puncture a spinal cord. So get help. support the neck until EMS can respond, and don't let the victim move around because you don't know what's underneath there. Obviously, that's an injury you can't see. Be cautious. Concussion.
Christina, before you go on, I just want to let you know that we have 15 minutes only left in our presentation. So maybe we can, maybe you can hit the highlights of the diabetes, asthma, and
oh my goodness, I'm really behind.
Discussion that we
okay. Concussions, just basically be careful of the people that say it's a cowboy way and they just want to keep on working. Concussions can be dangerous. They can be serious in terms of causing other problems down the road. Oh my goodness, I'm sorry, I am behind. Diabetes is the most common thing that we're seeing in the school districts now, that it is going up. 21 million adults and children. I'm going to skip over these. These are on the handouts, or facts. Type 1 diabetics are the most critical ones to control in the school district. We do have an obligation to provide resources for those people. Sometimes it's parents, staff members, nurses. Usually those kids wind up having to have some kind of insulin, either via pump or syringe during the day. Let me go through these. Long-term complications are bad, especially if the blood sugars are not controlled. 24/7 diabetes management. Every student is different, and they require constant juggling of insulin and medication with physical activity and food. Hypoglycemia is low blood sugar, hyper is high. Ketoacidosis requires hospitalization usually when the blood sugar is too high. Causes of hypoglycemia: never, ever, ever leave a student alone or send them away when experiencing hypoglycemia. Treat on the spot. Years ago, we did not allow kids to test in the classroom. That is not okay anymore. They need to treat this like a lifelong illness and be able to test and treat their lows and highs as they need to. Some of the signs: sudden change in behavior, sudden change in appearance, complaints of headache or weakness. Some kids get downright cranky. Response: check the blood sugar, give the child a quick-acting sugar, usually 15 grams of carbos. That's 4 ounces of juice, half can of regular soda. And then test the blood sugar 10 to 15 minutes later, and then repeat the treatment if the blood sugar is below the student's target range. This is the most immediate danger to kids with diabetes. They can drop their blood sugar down to 0 and have convulsions. It's a serious medical condition that we in the schools need to be prepared to deal with. And if your school nurse is not there all the time, you guys need to have a backup plan in your buildings on how to take care of the kids with diabetes. Response to severe hypoglycemia: position the student on the side, contact the school nurse or the backup, who is a trained diabetes staff. Glucagon is a hormone that raises blood sugar levels. And that is something allowed by Wyoming law that we can train, nurses can train lay personnel to give in an emergency. It's a life-saving treatment that cannot harm a student. And I would highly encourage you to have a group in your building who can respond to diabetes emergencies if you have a student with diabetes. Hyper is the high. The problem with the high is that it can cause long-term chronic conditions. They need access to the bathroom. They want to pee all the time. They need to take extra insulin, and that involves working with a nurse or the parent to figure out what needs to be done. This definitely needs a care plan in your schools, and you need to be working with your school nurse or other assigned person to work with that. As a staff member, the important things: this is a life skill. They need to be self-care. easy access to diabetes supplies. You need to make sure that they're taking their snacks and doing their blood sugars before lunch, before breakfast. Kids get thingy. They get cranky when they're high or low, and they're not going to be in the best mood to take tests. They can really not to perform well at the times of these highs and lows. So you can have a 504 plan, and healthcare plans work with your people in your building to make sure everybody's on board. Make sure your substitute teachers know what's going on with the child with diabetes. Free access. Parents can give permission to do classes for the classroom to see, to train other people. Make sure you let your parents know any changes to the class schedule, field trips, special events, field trip considerations. If it's an overnighter, what do they have to plan? We usually send a parent along or try to get a parent, but you can't require a parent to go, and we have sent nurses on field trips. Test taking, we talked about. PE, they might need to test before class or after class, and you want to make sure that they're allowed to carry a snack in the class. And these kids don't want attention brought to them, but they need to be able to treat their diabetes. Remember, every student is different. They don't want any unnecessary attention to the student be brought to their student's condition. Provide inconspicuous and general reminders. For instance, we had kids who would hold up a pink or blue 3x5 card to signal that they have to go to the bathroom so that the class isn't interrupted. There's things that you can work out with the kids. Don't sympathize, but empathize. Help them work through their problems. Be prepared. Use the buddy system. Don't ever leave a kid who's low or high by themselves. You can find them in an area where it isn't even accessible to kids because they get so confused. I've seen kids get angry when their blood sugars are wacky. Be patient. Keep the lines of communications open. And knowledge is power. Get yourself educated. American Red Cross has tons of stuff. There's a teaching what school needs to be trained on for diabetes. I have 5 minutes to jam in the rest of this. Asthma. Just a reminder. Normal airways. A picture here. An inflamed airway in an asthma attack severely blocks the airway. These kids get panicky. They can't clear their lungs, and they can just really get sick very fast. It can't be cured, but we can avoid the asthma triggers. These kids take long-term control medications, and then they have rescue medications. If it isn't under control, they can miss a lot of school and work, and they're not as productive. Some things to, just as an assessment, you as teachers, you're the first ones to see this generally. Look at the student and what's his posture, his color, how fast is he breathing? Is he agitated? Is that fear that they can't breathe well? Uncomfortable? Is the student able to talk? If they can't talk, they're having an asthma attack. What do you hear? I've heard kids wheeze, and you can hear them across the hall. What is he or she saying? He wants to lay down. He's crying. The little itty-bitty ones can't explain it. They're crying. You can't console them. Sometimes they'll get a pain in the chest today, or they might just say, I can't run today, or I can't keep up. Stop the student's activity, evaluate the situation, and get his quick relief rescue inhaler. Observe for at least 10 minutes if in distress. Don't let him take the inhaler and go back to the classroom or other activity. He needs to settle down, and probably sometimes that's the hardest thing to do, is to get him to settle in and just wait, because they're missing recess or they're missing PE. Never leave a student alone. Sips of warm water sometimes help. Quiet area, away from distractions. Do some practice with slow, regular breathing with the student. Important, call 911. If you're struggling to breathe, talk, stay awake. Is there any blueness around the face? Or ask for an ambulance. And if he doesn't improve after the administration of the medicine and the nurse or parent or guardian is not available, They can always refuse to be transported, but call 911. They have the equipment to manage these kids. And if you're not sure what to do, doesn't hurt. We do have the Wyoming emergency medication law where these kids can carry them with a doctor's note and the parent's permission. Be cautious, though, because the younger kids can overuse the inhaler. Seizures, I'm going to go right up to assist a student who's having a seizure, keep them safe, move the objects, prevent harm to student, provide privacy, stay with the student, position him on his side so that any vomitus or oral secretions can flow out. With assistance, you can lower the student to the floor and position. Send someone to call or send for the nurse. State the room number again. Always assign someone to get help if you're the only adult. Loose and tight-fitting clothing around the neck. Protective barrier for head on the floor. It helps to know what kind of movements they had, write observations, and look at how long that they had the seizure. Do not try to force the mouth open, or do not insert any padded object into the mouth. That's old-time stuff. Jaws have been broken. It's not a good thing anymore. General information. Don't be afraid of a seizure. Most seizures are self-limiting and will resolve without any intervention, and they do not require interventions except the aforementioned first aid. So, in a nutshell, I kind of ran through the last few minutes. But that's an overview of the most common scenarios in a school setting. I really would highly recommend a complete first aid course and CPR course for anybody who has delayed emergency response, or if your nurse is not readily available to respond to emergencies. It does not hurt. You could need it for your family members. School staff support and knowledge equals student success. If we keep these kids healthy and active and feeling well, they're going to do better. And my last plug, well, there's the references, but this is my last plug. Thank you for listening, and I'm sorry I had to rush you through. Every child deserves a school nurse. That's my plug for school nursing. And my email is on my handout if you decide to download it, or if you have any questions. I'm sorry we're running out of time. Feel free to email me, and I'd be happy to answer. Thank you.
Chris, thank you so much for all of that information. And yes, the presentation will be available on our website, thepeakstoprairies.org, and that will also contain your email and contact information if folks want to get in touch with you directly to ask you some further questions. And so I think with that, we'll close our webinar, and again, I thank you so much, Chris, for all this information you've provided with us.
You're quite welcome. I hope it was understandable for everyone.
Absolutely. Absolutely.